Hello, everyone. This is Earl Stephenson Jr., Atlanta board certified plastic surgeon, and I'm here on a Wednesday night. I'm live. I rarely do lives, but I may start doing more. This is what I'm going to call the aesthetic angle, and this is where I jump on and I give you kind of my opinion about trends in plastic surgery, what's going on in my practice, which is ESJ Aesthetics here in Dunwoody, Georgia. This is a chance, if you're joining me live, to ask me questions. And so this is a free flowing forum where we just discuss things. And again, it's called the aesthetic angle. We're giving it a go. This is our first episode, so welcome. Again, Earl Stephenson Jr., ESJ Aesthetics. We are located in Dunwoody, Georgia, and I wanted to start off with an interesting conversation I had today. I was having a conversation with the marketer, and we were talking about some things, and we were talking about my website. And so she made some comments about my website, some very good, some a little challenging to me and my ego, but that's where we are. So the website is not obviously for me, it's for you or anyone seeking aesthetic plastic surgery services. So I want you guys to do me a favor in the comments below now, or if you choose to watch the replay or watch this at a later date, is to look at my website. From your perspective, what's missing, what's good, what's bad, your opinion. Now, be easy, be nice. You don't have to be mean, you don't have to be ugly. If you don't like it, you don't like it. That's fine. You can simply say that. But this is not a space for ugliness. So I'm just asking your opinion because I always want to make things that are helpful to my current clients and future clients. So here's the website. There's the address. So again, if you don't mind, in the comments below, just give me suggestions. And I will read those suggestions and I will take them to heart. Now, I can't guarantee that I will use any suggestions, but it may give me thought. So again, this marketer brought up some points and I thought they were valid and valid enough for me to jump on here as the lead kind of story or discussion to say, hey, what do you guys think? So again, here's the website. Jump on, comb through it. Is it easy to navigate? Is it difficult to find information? You hate the pictures. There's not enough pictures. You hate everything. You want more answers. It's too long. Whatever your comments are, as long as they're nice and respectful. So thank you for that. And now let's swing and turn our attention to a couple of things. I commonly comb through social media, sometimes intentionally looking for things, most of the time unintentional as part of, I hate to say, relaxation. Social media is not relaxing if you just consume it at a gluttonous rate, but you know, everybody scrolls on their phone. I'm trying to be better about that, especially when I'm at home, trying to be intentional with the people at home, my wife in particular. But I do it and I'm trying to work on it. So as I was scrolling one evening, I found this video and I'm going to bring it up right now and we'll watch it. And then we'll discuss a couple of points I want to bring to light. There we go. I think that's the video. No, here we go. Let's try this.
Botched dental work in Turkey is now unable to breathe out of her nose and has a collapsed septum. Leanne says she was quoted about £50,000 to get dental implants fitted in the UK and instead found somewhere in Turkey that would do it for £3,000 cash up front. Although she got local anaesthetic, she says she could feel everything.
I could feel them pulling all my teeth out, the hammer pushing my sinuses up. It just felt like someone was running over your face with like broken glass being smashed into your face.
Her treatment has left her with a collapsed septum, which is the cartilage and bone that separates the nostrils, and constant infections. She said the NHS won't fix it because it's deemed a cosmetic procedure. You can read more about her experience on the link below. The NHS says it's not usually able to carry out any corrective surgery for anyone who has had complications with private cosmetic procedures carried out in the UK or abroad, unless there's an identified clinical need, and says it encourages anyone considering to get treatment abroad to do their research and consider the risks.
It's just been the worst experience that anyone could ever wish for.
All right. So that is a terrible experience. Uh-oh. Jump something there. Let's do this. Oh my goodness, I'm struggling. Okay, I'm back. I'm back. So that was a harrowing experience. So 2 points. First, we're going to talk about travel abroad, travel outside of the United States for procedures. You've seen me here, you've heard other people talk about it. At this point, you guys are going to do what you're going to do, but there are a couple of things you need to be wary of. If you're from the United States and you travel abroad, yes, they speak English in the particular country you may be going to, but you don't know the system. You don't know what your rights are or what rights you have or don't have. In this particular case, this lady had a terrible outcome, kind of a very unusual outcome from some dental implants that collapsed her nose. And so she thought she could seek some type of remuneration, restoration of this issue through, I guess, the medical government, medical society, governing bodies, medicine in the country of Turkey. She can't. So she's kind of stuck. Yeah. In her home country, she understands the laws. She understands the landscape. She understands her rights. So again, from the States, you understand if you live in Missoula, Montana, that in the state of Montana, there's the Montana Medical Board. You can file a complaint. You can seek, legal advice will help you negotiate the system if you feel that you've been harmed. Again, in a different country, you don't know what your rights are. So again, if you want to travel abroad, if it appeals to you to make it a vacation, it appeals to you because it's more cost effective. If it appeals to you that the doctors are better or have what you want, that's fine. But buyer beware. Know what your potential rights are. Kind of try to predict what may go wrong. Save your little nest egg just in case something goes wrong because you may have to fly back. You may have to pay more money. So keep these things in mind. So that's number one, travel abroad, know your rights, know what's possible and not possible if there's a problem. Number two, it revolves around this young lady's nose. She has to cover it with a band-aid because she's embarrassed about it. And it's a terrible, terrible tragedy. The nose is the center portion of our face, and everybody's drawn to it. I mean, without question. And this is a problem that is fixable, but it's only fixable by a certain number of people. Certain doctors can only do this. For clarity, I think board certified plastic surgeons obviously can fix this. We are trained in restoration, restoring normal anatomy and function, as well as aesthetics. Certainly, you can go to a head and neck surgeon, commonly called an ENT surgeon, commonly more called formerly an otorhinolaryngologist, facial plastic surgeon. Certainly, they are capable as well. But you want to make sure you get in the right hands. As a board certified plastic surgeon, also trained in maxillofacial surgery, I have a unique perspective on these type of disasters, whether it's from a mishap from cosmetic dentistry, a mishap from cosmetic surgery, cancer, or trauma. I have the expertise and experience to at least come up with plausible, reasonable solutions. So let me give you a case in point. So this is a case of a gentleman I did probably about more than a decade ago. We see on, if you're looking at the screen, top left, you see him as he originally presented to my office with this kind of cleft on his nose, and that was from a previous skin cancer removal. This guy spends a lot of time in the sun. You can see the blotchiness of his skin. These are probably pre-cancerous lesions. And what I mean by that, they're not quite cancer, but the skin is damaged and probably will progress to cancer if not treated. And then you see the picture on our right, which is where he had another cancer that was on the opposite side of his nose, opposite of that cleft that was red, and that was a skin cancer. So this was treated by a dermatologist, and specifically a Mohs, Mohs surgeon. It's a type of surgeon that it's a dermatologist particularly or typically, and they remove skin cancers, but they remove just what they need so that you have complete removal of the skin cancer with preservation of as much normal structure as possible. So they're very pointed and particular about what is necessary to rid the cancer. So this is what we were left with. So I used what we call in plastic surgery his own skin from his forehead to start to rebuild his nose. I used a flap, and that's the general term, that's spelled FLAP. And I was able to turn it down. I used kind of a finger like piece of skin where I went around with a scalpel and disconnected this part, but left the base of it connected to his brow. And I was able to turn it down and attach it to his nose. The thinking is that the tissue and circulation from his nose would grow into that flap and allow it to live in harmony with the rest of the nose. At some point, the tissue between the brow and the bridge of the nose would be removed so that from the front and particularly from the side, there's not this excess of skin. So we typically do this in 2 to 3 stages. I started out when I was younger, a younger surgeon, doing it in 2 stages. I think it needs at least 3 stages because we need to first bring down the tissue or perform the forehead flap. That's surgery one. We let that flap live and get its own circulation from the surrounding skin of the nose, and we may leave it for 6 weeks. Some people leave it as little as 3 weeks. Some people may go longer, depending on how well this looks or how healthy it looks. And then at a second surgery, what I typically do is I lift the flap up from where I've stitched it into the nose, lift it up and thin it because initially it's really thick. So we thin it on the undersurface and then put it back down so it fits more the natural contours. If I feel that the underlying structure, the cartilage, the flexible portion of ears and in the middle of the nose needs to be enhanced, then I will either get some cartilage from the inside middle bone or middle portion of the nose, or I'll get it from the ear and build up the structure of the nose, thin the flap from the undersurface, take out the fat and the muscle so that's a really thin moldable piece of skin and lay it back over so that that flap from the forehead starts to take on the natural contours of the nose. So that's surgery two. We stitch that back down and we let that heal for several weeks, 3, 4, 5, 6 weeks. And then we disconnect the flap, keeping it attached to the nose, disconnect it at a point that makes sense along the bridge. Sometimes it's here where a shadow would normally occur that will fall in a wrinkle or a line that looks natural. Sometimes it's higher, maybe it's closer to the brow, where again, you may have a natural wrinkle or tend to form a natural wrinkle where it looks normal. Once we've done that, the flap is then takes on the shape, hopefully, of the original nose and sometimes better. But it takes 3 stages to do so. So this is something that I specialize in. Oftentimes, this is an insurance issue, but I do not participate in insurance with insurance panels because they tend to restrict and restrain what is best for the client or patient and what's best strategy for that I can implement for that client or patient. So we work with our clients to provide them with documentation after we're said and done, or along the way if we have multiple procedures, so that they can submit the appropriate documentation to their insurance company for some type of reimbursement. Sometimes it's total reimbursement, or more often it's partial reimbursement. And so that it's a win-win. We have the flexibility on my end to do what's necessary and not be restrained by the insurance company. The patient has the flexibility of working with me and not only being subject to who's on his or her panel or network who may or may not have this expertise. So it's a win-win situation. So I wanted to share that with you in this first episode, nasal reconstruction. If you're interested, something that you know someone is struggling with in your family, or they're preparing to undergo removal of skin cancer, and you need a plastic surgeon, we specialize in this particular treatment. Pivoting totally along the same lines of travel, we're going to get back to traveling abroad. I find myself constantly and people calling my office constantly. You know, prior to this year, for sure, looking for a doctor who can take care of a complication or a perceived problem. I have physicians calling my office. I have hospital ER departments calling my office. Hey, we have a patient that was seen and treated in, you name the country, the Dominican Republic, uh, Turkey, you name the country, and they had a procedure, and now we think they have a complication from that procedure, cosmetic procedure, most often tummy tuck or facelift. And they're here in the emergency department, and we don't really handle this. Would you be willing to accept this? Prior to this year, I was not willing to accept this, but we've got so many calls from hospitals and doctors and even nurses that were that offer post-operative care, and patients themselves just hunting for anybody that can help them because they're back in the States and they can't afford to go back there, or their doctors where they had their procedure form are not being as responsive as they need to, and maybe they can't. Maybe there's some barriers here in the States that they can't overcome from their native country to help their clients. So we've stepped in as a stopgap for it. So, individual selected cases, we offer a plan to help you bridge that gap. And I like to introduce that plan. So we have a little advertisement. If you were kind of botched out of town, you need help, we offer the post-op peace plan. It's a really nice plan that can help you through that tough time. If you had surgery out of town or the country and you really don't have anywhere to turn, we'll be able to provide care for you. We've kind of designed packages that will help with your transition and help you get the care that you need. So this is an example of what we've got. Our post-operative peace aftercare is a concierge package. It involves, or usually involves a consultation so that we can kind of get down to the nature of the problem. It includes 3 follow-up visits after that consultation. You get priority scheduling. So if you call the office and you think you have a problem, you don't have to wait 2 or 3 weeks as we're booked out. We figure out a time that we can see you very readily within a couple of days, if not that same day, if that's possible. And looking forward, if we get you past that point and you're happy with our services, but you're not really happy with the outcome, then you get a credit toward any type of revision surgery that we may offer as a plan to get you back on track to give you the expectation that you wanted. It's a simple price. Pricing is 1750. That's paid at the time of your consultation, and it includes all that care and access to my staff and access to me. So again, if you feel like you've been out there left kind of floating, you've had surgery somewhere else, we will help you through that period. We do not take assumption of the responsibility of what was done or not done. We just try to get you over that crucial hump. And so just remember, we offer the post-op peace program. If again, you want to call our office and you're having those problems, just give us a call and book that consultation at 770-466-4700. All right. Last thing I want to talk about, what's going on in the office. We offer some values from time to time, season to season each year. And it's coming up on the holiday season. Excuse me, mouth is dry. A lot of parties, a lot of meetings, a lot of family get-togethers. And you're like, I can't go one more year and hide my neck. I'm tired of wearing turtleneck sweaters, even though it's comfortable. I really want to, show off and feel good about myself. A really nice, elegant procedure that we offer here at ESJ Aesthetics. It's chin liposuction or neck liposuction. It's done here in the office, and we've got a nice special for you. We typically offer that service for about $3,800, and now it's $2,800. So you get a nice savings, and it helps increase your confidence. You can see the difference and feel the confidence. This is an example of a chin liposuction that I performed most recently, and this is about a 6-week result, and this is going to continue to get better. You can see on the left, these are the before profile view and front on view. You can see the fullness in the neck that no one likes, especially women, because they want to make sure they show off their neck and décolleté. They can wear beautiful jewelry, appropriate wear, whether it's for after 5 or formal, and you can see the result on the right. Again, better contour of the profile and frontal view or neck view of the face. So again, we are having a little value added to your holiday season or in preparation to your holiday season. And again, if you are interested, it only takes you to do one thing. You just call 770-466-4700 and ask for a chin lipo special. So that's what's going on. That's what I wanted to talk to you about. We talked about the post-operative peace program that we have for people who are stuck after surgery abroad or surgery out of the state of Georgia. Call our office. We'll be able to help you through that tough time. We've got a nice value that we've added for a procedure that we offer, chin liposuction. It's now at an exclusive price point for just a limited time. So I would call, and if you're interested in that, schedule your consultation, and hopefully we can move forward with that. And then a signature procedure that we often perform when people have deformities of their nose, whether it's from cancer removal, whether it's from injury, whether it's from surgical mishap or complication from another surgery that actually damaged the nose, we can address that for you. So again, thank you for watching The Aesthetic Angle. This is ESJ Aesthetics, and I am Earl Stephenson Jr., Atlanta board certified plastic surgeon. Thanks for tuning in. Again, remember, check out my website, leave in the comments about any improvements that you think that would be beneficial for you or someone like you shopping or deciding if plastic surgery is right for them. Until next time, you guys have a wonderful evening. See you next time.